Hello, my name is Nicholas Paglia, and today's date is July 31st, 2021. The notes that I'll be using throughout this presentation, these right here. So this is module number 4 presentation on the skeletal system. And the main components of the skeletal, the skeleton, cartilages, ligaments, and other connective tissues, which ultimately work together to stabilize the bones. And all of our bones actually can be classified according to their shape. And I'm going to go over 7 of these. We have the sutural bones, which are small and flat. We have the pneumatized bones, which are bones that are hollow or contain many air pockets. We have the short bones, which are box-like in appearance. We have the irregular bones, which are complex shapes. They're short, flat, notched or ridged surfaces. You have the flat bones, which are thin parallel surfaces, compact bone on outside, and they're a spongy bone on inside. Long bones, which are long and slender, and sesamoid bones. The skeletal system is put into 2 different categories. It's the axial division and the appendicular division. And to start, we're going to discuss a little bit about the axial division, axial skeleton. So the axial skeleton contains the skull, vertebral column, and thoracic cage. And to start, we're going to talk about the skull, which contains the cranium, facial bones, and other associated bones. And to start, we're going to do the cranium. So this front bone right here is the frontal bone. The 2 sides are the right and left parietal bones. We have right over here the 2 temporal bones. The back of the head here is the occipital bone. You can see the ethmoid bone if you look right through the eye socket. And then you actually have the sphenoid bone, which you would be able to see. If you take off the top of the skull, it would be in here. And now we're going to start talking about the facial bones. We have our nasal bones. We have our lacrimal bones, which are actually lateral to the nasal bones. The vomer bone. You have the inferior nasal conchae. You have your 2 maxillae. You have your 2 palatine bones, which are actually on the roof of your mouth. Your jawbone right here, which is your mandible. And you have your 2 zygomatic bones right here and here, which actually make up our cheekbones and support our cheekbones. And next we have our associated bones of the skull, which are we have our auditory ossicles. They're on each side of the head, and they're actually enclosed in the temporal bones. You have your malleus incus stapes, 2 of these, and you have your hyoid bone, which is actually at the back of the throat. Now we're going to discuss a little bit about the vertebral column and the axial skeleton. I'm going to flip them around for this. So we have our cervical section. Each of the vertebrae are named after the first letter of the section and the subscript number naming which number vertebrae it is. You have atlas, which is your first vertebrae, and your axis, which is your second vertebrae, C1 and C2 respectively. And then you have C3 through 7 here. And then it brings us down to our 12 thoracic vertebrae, which goes T1 through 12 down to here. And then it goes to our 5 lumbar vertebrae, L1 through 5. And then that leads us right to our tailbone, which is comprised of our sacrum and our coccyx. You can see here, sacrum and coccyx. And basically, the sacrum and coccyx is your tailbone, and then you have so we flipped them back around, and then we have our thoracic cage, which is our rib cage, and we have 12 pairs of ribs. Pairs 1 through 7 are considered to be true ribs, connected to the sternum via costal cartilages. And ribs 8 through 10 are false ribs, and 8 through 10 do, in fact, articulate with the sternum. And ribs 11 through 12, which are right here, you can see they're not connected. They're actually called floating ribs because they're not connected to the sternum. And then we are going to now jump into our division. Shoulders, hips, appendages. So let's talk about the shoulders, also known as the pectoral girdle. You have your 2 S-shaped bones right here, also known as your clavicles. In the back is 2 flat, like triangular bones, and this is known as your scapula. And the upper bone of the arm right here is your humerus, and directly below is the ulna. And radius right here is actually lateral to the ulna, which is your lower arm. And then that brings us to our wrist right here. Our wrist actually has 2 rows of short bones. The first row is proximal carpals, and it starts at the lateral side of the scaphoid lunae. Carpals right here, which are starting laterally at the trapezium, trapezoid caput, and the hamate bones. And then we have our metacarpals, which make up bones in palm of our hands, and they're identified based on Roman numerals 1 through 5, 1, 2, 3, 4, 5. And then we have our finger bones, phalanges. The thumb actually has 2. It only has a proximal and distal, while the others have proximal, medial, and distal. So fingers have 3 bones, thumb has 2, proximal, middle, and distal. Thumb has the proximal and distal. And then we have our pelvic girdle and lower appendages. Our pelvic girdle is actually made up of our hip bone, sacrum, and coccyx. And our hip bones are 3 bones fused together, our ilium, pubis, and ischium. Then we're going to start talking about our lower appendages here. So we have right here this long bone. It's like the longest bone in our body. It's the femur, otherwise known more commonly as like the thigh bone. And then below we have our tibia and fibula. And then right in between we have our kneecap, which is called the patella. And then we have our tarsal bones at ankles right here, the calcaneus bone, which is your heel bone, and then we have our talus bone, and then in the lateral cuneiform bone and cuboid bone, here and here. And then the foot bones are actually called metatarsals, and it's very similar to the fingers metacarpals. The toe bones are also called phalanges, and the big toe right here is just like the thumb. It actually has 2 bones, proximal and distal, just like the thumb. And the other toes have 3 bones, proximal, medial, and distal. And proximal meaning closer, medial in the middle, and distal farther away. And that's it for the anatomy of the skeletal system, going over the axial and appendicular divisions. To provide an example of a clinical application of anatomy in my future career, so using anatomy and knowledge of the skeletal system in occupational therapy is important because it teaches you different essential bodily movements that are necessary for performing everyday essential life functions. And this is essential to understanding how and why certain aspects of the human body move in the way that they do, which is actually paramount to becoming a competent occupational therapist by helping your patients basically just thrive in everyday life. And an example of an actual scenario would be an occupational therapy situation with a client focusing on fine motor skills in the hand, per se. So if a client comes to me, is struggling to complete a task, for example, writing like a paper, as an occupational therapist, I can work to pinpoint certain problem areas the patient is experiencing regarding their overall hand function and work to create care plans with the patient that will help utilize will inadvertently work to exercise that area of the hand to help them ultimately regain the ability to complete similar fine motor skill tasks with that hand again. Thank you.